To put it bluntly, we are far from being over the hump when it comes to flattening the COVID-19 infection curve. New computer modeling suggests the Golden Empire could be at least half a year away from reaching its peak in COVID hospitalizations, and that could potentially overload hospitals past their surge capacities. Now the question turns to what happens if we do in fact go beyond surge capacity. 17's Eytan Wallace joins us live outside Kern Medical tonight with the latest. Good evening, Eytan.
Good evening, Tammy, and it's a very real question, but I want to begin with the numbers. In just a few months, hospitals like Kern Medical could be in some significant trouble. That is because new data suggests the worst could still be yet to come. And as I show you some video here, Kern County is home to 10 hospitals, and as it stands right now, there are 911 hospital beds available in the Golden Empire. But a new state model, which takes into account variables like population, hospitalization rates, and number of hospital beds, suggests the worst really could still be yet to come for Kern hospitals. At Monday morning's press briefing, county leaders said the model suggests Kern will see a peak of 679 hospitalizations in February 2021. Diving further into the numbers, the model says Kern County will exceed its normal intensive care unit or ICU capacity of 78 ICU beds by the end of July and will reach its surge capacity of 294 ICU beds by November. The model indicates come February 2021, Kern will see its peak of ICU patients at 436, more than 140 above the county's ICU surge capacity. So what happens if we do in fact breach the surge capacity? Well, 2 exhibit buildings at the Kern County Fairgrounds have been designated as an alternative care site that can hold up to an additional 250 beds. But the plan poses a challenge as it limits only specific patients.
The alternative care site was designed to hold a maximum of 250 individuals, but not at the ICU level. This is at a much lower level. We don't necessarily have to use it for, just as it was designed for COVID positive, low acuity hospitalized patients, but in fact in any way that would help alleviate some of the stress and the surges that we're going to see in the hospitals.
And therein lies the dilemma. Constantine says county leaders and medical leaders are in talks to come up with a plan in the event County of Kern exceeds its ICU bed capacity specifically. Now, Kern Medical CEO Russell Judd also spoke today. He said Kern hospitals are ready for such a scenario, but he also stressed this model is just that. It's a model. It's a prediction. So he says the projections could change, and that, he says, depends on all of us to follow CDC recommendations like washing hands, of course, social distancing, and wearing face coverings. Reporting live in East Bakersfield, Eytan Wallace, 17 News.